My name is Rubens Kignel. I am a psychotherapist and teacher.
Yes.
I come from Brazil,
Yes.
where I have my clinic. It's the place where I work
Yes.
with patients,
Yes.
and also teach in Europe in different schools of body psychotherapy, biodynamic, biosynthesis, etc. Okay. And I am here with you now so that we can share a little bit about what psychotherapy for you and have a little dialogue about it. So do you mind to just introduce yourself?
I will. My name is Berit, Heir, Bunkan. I come from Oslo in Norway, and we have a very special tradition in Oslo, because Wilhelm Reich stayed in Norway before the war, and he lived with his girlfriend Elsa Lindberg. I knew her, but I didn't know Reich. But in Norway, Reich became persona non grata. There was very much discussion around him, and one of the opponents was the head of the University Psychiatric Clinic, called Brotøy, a very famous man in Norway. But you see, Brotøy, even being in opposition to Reich's tough way of treating, Brotøy was very influenced by Wilhelm Reich. So, at the same time as Wilhelm Reich stayed in Norway, there was another Jew called Fenichel. And Fenichel was the therapist of Brotøy and a very close friend of Wilhelm Reich. So, Fenichel said that every good psychoanalyst should have their own top physiotherapist to treat the body, because the resistance to change and to experience emotions is in the body, the tension in the body. So, and they started to develop a therapy. These two people, Brotøy with his excellent physiotherapist called Bülow Hansen, and they developed this therapy. You may know Gerda Boysen, perhaps.
Yes.
We were educated at the same time, and Gerda had lots of ideas always in her head.
Yes,
and
it's true.
Yeah.
I did a whole training with her in London, so I got to know her very closely.
Oh,
yes,
I see. Then you know what I'm speaking about.
Yes, sure.
And she was the princess of Bülow Hansen.
Bülow Hansen.
She was the favorite, but then Bülow Hansen found that Gerda had too many ideas, too strange ideas, and then she was not the princess anymore. Then I became the princess.
I see.
I had to live up to her ambitions, and she was very good to me. But I found that I knew too little. So when I signed on in the university to become a psychologist, magister in psychology is not the same as a master. It takes 7 years to become that. Then she didn't like me anymore. She said that I should think myself and not reproduce what other people has been thinking.
Mm-hmm.
So I tried to do both. Well, then I started to build up education for physiotherapists, first and foremost for her earliest students, because the thing had changed. And then this developed year by year, and if you want me to speak a little about what I mean by psychotherapy, well, when I do the body therapy, I take the consequences of that resistance to feelings that is unpleasant, and to bad memories, and to hostility, and everything sits in the body. But since the therapy in the beginning was developed for physiotherapists, it came very soft and we did not have any acting out, because the doctors at that time, they said if the patient was weeping, it was too hard and they had to seponate it. But it's not like that anymore. So the therapy has developed. And I say something about the thinking. You want me to say that?
Yes, please.
Yes.
Yes, please.
So what we work on is the whole body. You know that many people do that. But we do to get you see, respiration and posture is very close together.
Yes.
So if you have a stiff back, I know that the backside of your diaphragm has to be stiff too.
Yes.
You know.
It is.
Yes. So we do that, and to get a floating respiration, we have to have a stable posture. We have to have soft movements, and we have to have a good consistency in the muscles. Not too hard, not too soft.
Yes.
You understand?
They should be tonic. No?
Yes.
In tonus, I would say.
Yeah. And then we use the reflexes of the body to reach there. To yesterday, when I was working with the middle diaphragm, the lower diaphragm, and this diaphragm, I did it to release, to have the movements, but also to release the jaw. A jaw is a big jaw in standing position, open up, and a full stretch of the body.
What was June?
Yawn, gaping.
Okay. Yawn. Okay.
Yeah, that's the yawn.
Okay.
So we try to release the jaw.
Okay. So the person.
That is not enough.
Okay.
So it has to come from within.
Yes.
So I don't ask them to do the jaw.
Mm-hmm.
I do things that releases the jaw
I see. Yes.
to make it come from
Yes. To
inside.
stimulate somehow.
Yes, I do.
yawn. Yes.
I do. And at the same time, to get the big jaw, you have to have contact. You have to feel the extensors of the body, both in the arms and in all extremities. So, what do I do then? So
Yes. How do you stimulate the yawn?
I can do it on you if you like.
Yes, you can. Yes.
But that's not so easy. But I start when I work with the 3 diaphragm. I start with the jaw, and then to get a good posture, I also use the stretch reflexes in the body. Because if the stretch reflex and the yawn is well developed, all reflexes in the body works well.
Yes, I'm following. Yes.
Because all reflexes on this level are related.
They are connected.
Yes.
Yes.
So if you have that, you know that the orgasm reflex go well, you know that the internal organs works well.
Yes.
So that's how we are thinking and how we do it.
When you talk about 3 diaphragms,
I speak about them if you like.
yeah, where are them? Are they located somewhere? Or
Yes.
Is it where?
Yes.
Yeah.
All the way. I'll tell you about the middle diaphragm.
That's the middle diaphragm.
The middle diaphragm is attached all the way around
Yes.
to the back.
Good. That's like a plate is the muscle.
A dome.
Yeah.
A dome.
A dome. Yes.
Yeah. With the muscles at the top and tendons. It's a small muscle, but the tendons are very long.
Mm-hmm.
And the tendon at the back, integrated with the quadratus lumborum. Are you a doctor or something?
No, but I understand. Yes. Yes.
There are many muscles here, and the tendons from diaphragm do this with quadratus lumborum, with latissimus, and with some of the back muscles.
Yes.
So
that's the middle diaphragm.
That's middle, and the middle diaphragm work together with the intercostals.
Yes.
But you know, when the middle diaphragm goes down, the thorax gets bigger.
Yes.
And then all the blood is sucked up here. And when and when the middle diaphragm goes up, the thorax is smaller, and then all the blood goes out to the body.
Yes. Circulates, goes down, circulates.
I could say a lot about the things inside, but then will I have half an hour to speak.
Okay, go ahead.
Is that then? I'll tell you about. But you see, when you breathe in, the abdomen gets smaller.
Yes.
The intestine, and then the circulation goes up.
Yes.
Yes.
Come up.
Yeah, and then the circulation goes to the legs. So the movement of the middle diaphragm is very important for your liver, for your spleen, for your colon,
Yes.
and for the guts.
Yes.
Yes, you know that.
Yeah, so that they work properly.
Yeah, absolutely.
Yes.
So, I'll be very, very brief. And then we have the lower diaphragm.
Yes.
And the lower diaphragm can be too slack, too hard. And if it's too slack and too hard, you get leakages. You know, male leakages, female leakages, and if it doesn't work, the lower diaphragm follows the upper one. So it's mobile because when the diaphragm goes down, the bottom of the pelvis also has to go down. So the lower diaphragm is a little diaphragm, but I look upon all the muscles around as part of the diaphragmatic movement. So then it goes down, but even then, if it follows the middle one, you can do what you like down there. I can squeeze it and I can do everything. So this diaphragm is very important for the life of the organs in the pelvis. And then you have the uterus, you have the bladder, and if it's bad work, they easily get infection in the urine,
Yes.
particularly women, and it can go all the way up to the kidneys. And yes, and the sex function badly, you know, and the menstruation in women functions badly, and childbirth is more difficult. You see that?
Yes. And it is located
No,
in
it's
this
further,
area.
it's further down.
In the pubis. In the pubis.
Pubis, and
in the coccyx.
and the part of the not the coccyx, but
Bit up.
Bit up, yes.
Bit up.
Yes. So that's the lower diaphragm. And the lower diaphragm is also important for the nourishment of the hip joints. So in Norway, very many people have poor hip joints. They have the joints changed because they are too stiff down here, and there's one reason, many other too. And the hip joints do not get enough nourishment because the hip joints are also dependent on the lower diaphragm for nourishment.
Yes.
And another thing, that when you have a good diaphragmatic movement with these two, it's important for the corpora. You know corpora?
Yes.
Or the columna.
On the column.
And between there are discs, and the discs are very small capillaries, microscopic capillaries. So if this works bad, there is not enough circulation to the discs.
And that is my pain.
I think so. I think so.
Yeah.
And then we have the upper diaphragm, which is under the thumb. It's also important because it is a thumb bone. It's an important bone.
Yeah.
And it's called the hyoid. And there's a suprahyoid muscles going to the chin and the diaphragm here, and the infrahyoid muscles come down to the chest. So the chest is so important because it can be a flat chest, it can be a big chest, and can be an overexpanded chest, which you will see in asthma and many other diseases. So, and if you have anxiety, the chest blows out, and it blows very much out, it will be expanded. And then these auxiliary muscles between the neck and the chest hold the chest up. And then the person will get very tense also here. And then you have a neck that goes like that.
Yes.
And then you have to look up at all people. Well, that's not very good. So then and the children who have this, the jaw goes down. And then the child or the person for this look stupid. What is happening? So when the father or the mother asks the person to close the mouth, the head goes down. And then the person have to contract the Rosetta muscles to get the head up and to meet the other person on the equal level. Oh, this is very much. So when there is tenseness and the person has to use the neck recessa, the nerves occipitalis that comes to the eyes always also is affected.
I see. So, of course, in our experience, when we liberate these tensions from the body coming from the three diaphragms, and then that liberation will bring some history together from the person. It does bring
very much
the history. Yes, and then we have to somehow accompany or work with that history that are being revealed.
Yes.
You know, coming out. Sometimes I say by surprise, but it's not by surprise. But we learn about that. I was working with a patient in Japan, and was very interesting. I was just teaching the group. Was a training group. I was teaching the group how to follow a movement blocked in the body.
Yes.
So there was this woman there, and I was looking at her. I couldn't see anything so essential there. I just saw a little bit hair and a head like that, you know.
See.
And then I just put my hand here and asked her to follow. Let come the movement against my hand, you know. And that was very interesting because the movement was coming, and what came out suddenly, and suddenly she did remember, you know, a situation with her father, where her father was invasive and abusive by coming from the back, you know, and putting his hand on her chest, or on her breasts, you know, and all that came out out of a developing, stressing movement, of course, together with the muscles, you know.
Yes.
And
that's what happens when I do this.
Yes.
This was happening. And I call this is the psychotherapy of the body.
Yes.
And that's a different psychotherapy from the psychotherapy that's only in the brain.
Yes.
The psychoanalysis is here, then in body psychotherapy, in MI therapy, is in the whole body.
Yes.
Good.
Good.
So you can't work with the three diaphragms. You must take care of what comes out. And then you have to understand a lot about people.
Yes.
So you don't push them, because you push it too hard, they lock even more.
Yes.
So you have to be soft, and you have to wait for it coming. And you said something very important. You said, what do you feel? What do you feel now? And I asked you, what do you feel? And I asked you, what kind of movements do you want to do?
Yes.
Yes.
Or let your body do that movement
absolutely.
and follow the body. And many times we are not conscious of what could come out from that. We just follow that.
Yes.
And the history
Yes.
really is being revealed.
Yes.
One another, I think, interesting thing for me from Norway, as far as I know, maybe you can correct me if I am wrong, but when Reich went to Oslo, you know, I think there was already a movement in Norway, physiotherapy connected with psychology somehow, and I think in Norway they had already this contact with vegetotherapy. Is that correct?
No,
No?
no, it's not correct. Because we had one famous man there called Ola Raknes.
Ola Raknes, yes.
Ola Raknes.
Yes.
He was a philosopher, and he also had worked in France and made a dictionary between French and English. So he was a very gifted man, and he became a friend of Reich.
Yes.
And then Reich learned a lot from him.
Mm.
He knew a lot about the body, but there was nothing among the physiotherapists and nothing among the other people. But Reich they were close friends, you see. And Ola Raknes, a very practical man and a good thinker. So they had so many fruitful discussions. And Reich has not referred enough to Ola Raknes in Norway.
It's true.
Yes, that's true.
That's true.
Yeah.
I think Gerda referred to Ola Raknes, or
Yeah.
Bodella referred
Yeah.
to Ola Raknes, but Reich did not.
No,
Yes, yeah.
when he did, Reich didn't even refer to Elsa Lindberg, the prima ballerina from the Berliner Opera, with whom he lived in Norway, and was not always faithful to her. You know that too.
Yes,
So
yes.
she didn't want to go with him to USA.
We can say that Reich was a bit narcissistic.
Yes. Yes, but I don't think he could have been what he is without being so
much
narcissistic.
into himself. Yeah.
So that propelled his research.
Yes.
Yeah, I think so.
I think so too.
Yeah.
Yeah.
Then we agree on many things. Yes, yeah, we do. But what I can, up till now, I have
Yes.
not seen that the body psychotherapist works so much on the reflexes in the body.
Mm.
So last night when I had my workshop, I ended up with having people to bend forward and to do a little bit of, soft exercises and to stimulate their feet so that they could come up and keep the posture, in a good position.
Yes.
Yeah.
But you are absolutely. It's very clear when you say that the breathing and posture they have.
Yeah, that's the same. It's not the same thing, but
it is interconnected.
it's so interconnected. You
Yes.
have, and if you're stiff in the muscles,
Yeah.
it hampers all the things. You have to work on all these the four main things: posture, respiration, movements, and muscles.
Yes.
So I just showed a small bit of it, but we have a lot of grips. I think Gerda might have shown you for the massage,
Yes.
and we do little pinches in the muscles
Yes,
and
yes.
ask them to say, ow, and ask them to stretch instead of going in flexion.
Yes.
That's how we work on the muscles too.
Yes.
That's reflexes.
Yes.
Yes. So if you are educated by Gerda, you would know that.
I know about it.
Yes, you know
of
that.
course. Yes.
Yeah.
The reflexes. Yes.
Mm.
I work with that
Yes.
to find the
Yeah.
reflexes.
Yes. But we also work on the joints.
Yes.
This is on the reflex on the muscle.
On the muscle. You work directly on the joints.
Yes. Well, you can do it. You do it with movements.
Yes.
I do it with movement also. So I don't know what you call this, a little dance, and you're bending forward and get the stimuli to get up.
Okay.
Yes. Yes, you're a very nice man.
You are a nice woman too. Thank you very much.
It's been a pleasure to meet you.
Yes. Thank you. Thank you.
I never forget you.
I
You're
will
the
never
man from Brazil and the
Yeah.
girl from Norway.
And I will never forget you too. Thank you for
Thank you.
giving your time to
Yeah,
me.
that's been
and
very nice, a pleasure.
I think people will enjoy
I hope so.
to listen to you. Thank you very much.